Community Plan Heat Illness Prevention, Corey Ailes, Herzing University, NU 474, Community Health Nursing, February 19, 2019. Healthcare includes public health, which focuses on the health of communities of individuals. There is a particular focus on prevention. It was through the use of the program planning that a community plan was developed to address a need within my local community. Program planning involves assessment, diagnosis, planning, including the formation of partnerships and utilization of resources, along with the implementation and evaluation. Defining the community. According to Herzing University, a community is defined in terms of common interest or characteristics, geographical boundaries, or a system. Through public health, the focus is more refined to populations that are free living in the community and share one or more personal or environmental characteristics. Troy is a thriving Midwestern town in Ohio located in Miami County. It is considered a small town, but it is close to three of Ohio's largest cities. It is a predominantly white community with roughly 25,000 residents who are of middle-class status. The windshield survey is valuable in assessing a community as it allows one to make actual observations about a community and its dynamics. Troy is located along I-75 as well as being close to the I-75-I-70 interchange. The community is clean and well kept. The individual neighborhoods consist of single homes, doubles, and apartments. Multiple businesses and schools are located in Troy. Options for children to participate in organized activities are available throughout the year, and there's access to many parks and public spaces, including multiple sports fields that include baseball, soccer, disc golf, basketball, tennis, and swimming. Although a windshield survey is a very thorough assessment regarding the entire community identified, it can also be used to help identify through observation needs within the community as well as its subcommunities that make up the whole. The recognized issue was that the sports complex, specifically owned and dedicated to the Junior Baseball League and serves the use of Troy, is located in an area where there is little to no shade. A community health assessment helps to identify important health needs and issues of a community through the collection and analysis of data. One can note that the ages of people living in Troy range from newborn to the elderly, and the leading cause of death are from cancer, pneumonia, heart, respiratory, cerebral, and drug issues. It was also noted that in 2017, 10 child deaths were documented for the county. 3 partnerships were fundamental to my community project. The first being with my preceptor, Stephanie Fox, who saw the value and need for a heat stroke protocol within the Troy Junior Baseball organization, and advocated for this and for myself to provide the service to Troy Junior Baseball through the community project. The second partnership is with the board of Troy Junior Baseball. Their approval was necessary to carry out the project and will be required to implement the product of the project into their overall program once the project is completed. Although I had to identify a need, I also had to seek the recognition of that need from the Troy Junior Baseball board, as the need was directly related to their program in the community. Resources used for the project planning and implementation include my preceptor, as she is a wealth of knowledge regarding Troy Junior Baseball's current policies and procedures. It includes the coaches and volunteers, as they will be the individuals responsible to fully implement the protocol along with the Troy Junior Baseball board members. The Troy Junior Baseball board will also provide the resources to supply the informational sheets to the coaches and ensure the necessary supplies are located at the ballpark to carry out the protocol successfully. Through assessment, there was found to be inadequate shade at the junior ballpark located in Troy, as well as a knowledge deficit among coaches and Troy Junior Baseball board members. Therefore, a diagnosis was formed as follows. Risk of heat stroke or exhaustion among Troy Junior Baseball participants related to lack of heat stroke or exhaustion protocol within the program, knowledge deficit among board members and coaches about heat stroke exhaustion signs and symptoms and prevention and care, and knowledge deficit among board members and coaches about contributing environmental factors in the area. Through my partnership with the board of Troy Junior Baseball and my preceptor, it was found that a protocol did not exist in their policies that addressed heat illness, nor did they provide any education to the coaches and volunteers. Many board members stated that they themselves were uneducated on the topic. A community plan was created to create a heat illness protocol that includes education regarding heat illness, including signs and symptoms, education regarding prevention of heat illness, and a protocol for actions to be taken should an event occur. Working closely with my preceptor and the board, a protocol was developed to provide education and an action plan in case such an illness were to occur. Thorough research was conducted, as heat stroke protocols are not required by sports organizations in the state of Ohio. It was important to use relevant evidence-based practice material that was suitable for Troy Junior Baseball. The protocol and education format had to fit within the organization with ease and be of simplistic nature to accommodate for non-medical backgrounds. The action plan also had to be within the means of Troy Junior Baseball, the ballpark, and the individuals involved to carry out the plan. A map was also generated of the ballpark to accompany the protocol to identify shaded areas closest to the fields for the coaches to reference. An informational sheet was created to accompany the protocol and map so that coaches and volunteers would be able to quickly reference a summary of the required educational PowerPoint. This informational sheet also provides prevention techniques for the coaches to implement at practices and games, as well as encourage parents to follow. An acknowledgement form that is to be signed by all coaches and volunteers and Troy Junior Baseball board members prior to the start of the 2019 season, and many seasons to come, was also created. This, along with the protocol and informational sheets, will be provided at the coaches' meeting prior to the start of the season. Proposed evaluation methods include formative evaluation. This would include discussions with coaches and parents and asking whether or not they are implementing prevention techniques. On-site visits would also be conducted. This would allow one to visibly observe if prevention techniques are being implemented by both the coaches and the parents. Outcome method includes analyzing what percentage of coaches and parents actually utilize prevention techniques throughout the season. Use of a survey to determine if coaches felt better prepared in regards to heat illness and what to do should such an occurrence happen. And did any heat-related events actually occur? This would also include evaluating if the protocol was properly implemented and implemented correctly. What was the ultimate outcome of that incident? Public health focuses on the entire health of a population. It is through assessment that needs are identified and through planning and implementation that they are addressed. Evaluation allows for recognizing areas for improvement and realization of goals that were met or unmet. With this process, an assessment was completed and a risk was identified within the Troy Junior Baseball community. It was through the use of program planning that a relationship was developed with appropriate stakeholders and a plan to address the risk, including necessary interventions, was created. Together with the stakeholders, a final plan for implementation is in place to reduce the risk of heat-related illness and improve the health of participants within their organization.